Introduction. Imagine women who unknowingly drink a neurotoxin before finding out they are pregnant. The chemical is unavoidable because it is pervasive in drinking water, yet frequently causes brain damage, leading to learning disabilities, attention problems, hyperactivity, impulsivity, emotional outbursts, and even intellectual disability in 10 to 15% of affected children. Some women are cautious, educated, or intuitive enough to avoid it. They have the means to purchase filtered water lacking the harmful substance. Planning their pregnancies carefully, they use contraception and other means to avoid pregnancy until they are able to drink safe water. Other women unintentionally expose their babies during unplanned pregnancies, are oblivious to the chemical's presence, drink without understanding the risks, or simply lack access to safe water. Unaware of the brain damage to their child, ambivalent or otherwise unable to make a change, they drink the water despite risks to the unborn. The society is our own, and the chemical is alcohol, our social drug of choice. The phenomenon known as neurodevelopmental disorder associated with prenatal alcohol exposure, ND-PAE, is a prevalent yet preventable cause of subtle to severe brain damage, which affects 1 in 20 American children. Like many other people whose lives have been transformed by this epidemic, I first learned about prenatal alcohol-induced developmental disability from The Broken Cord by Michael Doris. In April 1993, Doris's provocative story about his adoptive Native American son with fetal alcohol syndrome prompted me to leave a promising career in pharmaceutical research to attend public health school at the University of North Carolina. I soon realized that medical professionals, especially physicians, are as uneducated and as intellectually deaf as the lay public to the problem. Their use of the term funny-looking kid, or FLK, on charts of children with dysmorphic features due to this condition led me to endure the chronic pain of medical school at UNC and a 3-year residency in psychiatry at Georgetown, plus a 2-year fellowship focusing on children and adolescents at Children's National Medical Center. I have since developed a successful approach to psychiatric management of these children using a neurodevelopmental treatment model. I am a clinician working with children, adolescents, and adults, not a researcher. My perspectives stem from a career encompassing pharmaceutical research, public health, and medicine. Throughout the book, I share personal and professional experiences contributing to insights that prenatal alcohol exposure has caused a hidden epidemic with complex social consequences. As a board-certified psychiatrist, I have encountered ambivalence among community leaders and policymakers, disbelief and misdiagnosis by physicians, struggles of parents and caregivers, and catastrophic consequences of unrecognized cases on death row. The names of real-life patients and their families have been changed to protect confidentiality. The silent epidemic is not about a contagious disease in the usual sense of an illness like smallpox, Ebola, or HIV that is transmitted between people or communities. Instead, it is about a prevalent, endemic, and commonly unrecognized preventable condition known as fetal alcohol spectrum disorder, or FASD. Fetal alcohol syndrome, FAS, is at the severe end of this spectrum of alcohol-induced birth defects and is represented by the most easily recognized cases. Yet impairments in neurocognitive, adaptive functioning, and self-regulation exist to a greater or lesser degree in all individuals with FASD. This range of alcohol-related neurodevelopmental issues is listed in the Psychiatrist's Guidebook, the Diagnostic and Statistical Manual 5th edition, DSM-5, as neurodevelopmental disorder associated with prenatal alcohol exposure, ND-PAE. For simplification of terms, I will use ND-PAE throughout the book to reference this condition except when necessary for clarification of terms. This book is limited to discussions about effects of prenatal alcohol exposure and is not an encyclopedia of all reproductive consequences of alcohol. While there is mounting evidence that paternal alcohol exposure changes one's susceptibility, epigenetic effects to alcohol use disorders, and possibly other conditions, the effects of the father drinking is beyond the scope of this book. In the least, fathers' involvement in helping mothers achieve sobriety by their own healthy lifestyles is as implicit in prevention efforts as supporting reproductive age women in their recovery process before and during pregnancy. Other books, such as Drink: The Intimate Relationship Between Women and Alcohol by Ann Dowsett Johnston, provide a poignant look into the culture of drinking among women that, while related, is outside the realm of this call to action. The silent epidemic is not meant to solve the social problems so enmeshed in our collective conscience that we have become tolerant and complacent to the pervasive consequences. Instead, it is merely a wake-up call about prenatal alcohol-induced brain damage for the betterment of humanity. Much of my perspectives about prenatal alcohol's hidden effects on our society are mirrored in Brave New World, published in 1932, just a year before the repeal of Prohibition. The shocking truth is that the author, Aldous Huxley, knew the dirty little secret about alcohol neurotoxicity all the way back then, and so did many other educated men of his time. Capitalizing on knowledge of alcohol's harmful effects on the developing brain, Huxley, the English philosopher and French professor, envisioned a designer society by exposing certain classes to alcohol before birth. Huxley's scientifically bioengineered social structure has evolved naturally in our modern culture of self-medication, intoxication, ignorance, and sexual bliss. There could be no better imagined system to stratify society than a beverage as ubiquitous and seemingly harmless as alcohol. It is not surprising that we Americans have created our own social caste system in populations where intoxication is socially condoned and half of all pregnancies are unintended. Huxley's miscalculation was the benefits of an emotionally cocooning home with nurturing, consistent parents who model self-regulation and stability. The biologically engineered progeny of Brave New World were raised in sterile nurseries with auditory programming while they slept and Pavlovian conditioning during the school day. He assumed that group-raised infants would be better suited to a caste-based system than children growing up in chaotic, fractured home environments. We now realize the neurodevelopmental harm of group rearing systems, orphanages for any child. An understanding of the intrinsic hardwiring issues caused by prenatal alcohol exposure clarifies the nature versus nurture debate to explain many social problems. The neuronal wiring nature for children with ND-PAE leaves them at further risk for attachment issues, especially when their caregiving environment, nurture, is less than optimal. Thus, the collision of two perfect storms, ND-PAE and childhood abuse, remains an invisible yet well-defined pathway to violent antisocial tendencies. When children with ND-PAE are raised from birth in emotionally supportive, stable families with the proper knowledge, education, and supports to care for a neurodevelopmentally challenged child, the prognosis is much better than those suffering abuse, neglect, institutionalization, or other early trauma. Tragically, our indiscriminate use of alcohol during reproductive years has led to this costly yet silent epidemic through varying degrees of impairment in some exposed offspring. Numerous books for the lay public have been written describing the history, impact on individuals, and effects on society. Yet social drinkers are no more informed of the risk to an unintended pregnancy than women were in the early 1960s who were prescribed thalidomide to prevent morning sickness. Why is it that books like Drink, Message in a Bottle, or Damaged Angels collect dust on shelves while more sensational books like Take Back Your Pregnancy receive wide readership and press coverage? Society prefers to overlook the pain and suffering of lives lost within the glass of its beloved aphrodisiac. Our medical profession, public health community, and private sector can do more to prevent the unthinkable. Given that humans enjoy alcohol and sex, and that over half of U.S. pregnancies are unintended, mistimed, or unplanned, the time has come for physicians to encourage their sexually active, childbearing age, alcohol-consuming patients to use reliable contraception. In keeping with thalidomide and Retin-A policy, sensible and proactive birth control should be recommended for alcohol users. These drugs, unlike alcohol, are classified Category X by the FDA and are not to be prescribed if there is any chance of pregnancy. The public deserves an understanding of the need for radical transformation. On the order of eliminating pesticides from the food chain, removing lead from paint and gasoline, and reducing smoking in public places. These are all secondary exposures to noxious chemicals that cause harm to individuals. As a society, we all agree that the risks of such exposures outweighs any benefits to the individual consumer, and that protection of the public exceeds the rights of the individual. The alcohol industry, the government, and medical professionals have a duty to warn the public that alcohol causes faulty wiring in the brains of our children. Informed use of alcohol includes educating consumers about the harm to the unborn even before we know they exist. Simply put, avoid pregnancy if using alcohol, and avoid alcohol if pregnant or planning a pregnancy. The public health and mental health benefits of promoting contraceptives for alcohol consumers is synonymous with raising the legal drinking age and the effort to reduce driving under the influence. On this issue, political and religious groups should agree that the ethical right for each child to have his or her God-given healthy brain to live a morally sound, productive life outweighs any concern about promoting contraception for alcohol consumers. The purpose of this book is threefold. Number one, to highlight the magnitude of this preventable condition. Number two, to enlighten physicians, caregivers, child welfare advocates, and professionals that there is hope for these children. And number three, to inform childbearing age alcohol consumers to make educated choices. Part 1 sheds light on cases of individuals with ND-PAE from the backdrop of an affluent suburban community to a multi-state forensic psychiatry practice. Historical anecdotes and policy references are mentioned, along with my clinical perspective and approach depending on the context of the case. Appendix One provides specific diagnostic considerations and treatment recommendations, particularly relevant for parents, caregivers, medical providers, and community professionals. Methods for identifying, intervening, and treating this condition are emphasized. While miswired brain circuitry will not be able to be reconstructed altogether, neuronal restructuring during the first 3 years of life and during adolescence can be improved by an emotionally calm, safe environment with a nurturing primary caregiver and a community of people who understand their strengths and vulnerabilities. Appendix 2 guides readers through a listing of national and international resources that will be updated by a website providing useful information for physicians, families, and caregivers. These are dedicated to help support families and professionals. The silent epidemic is not to be a standalone encyclopedia of ND-PAE. Instead, I am hopeful that it will inspire, motivate, and inform readers to become agents of change in this epidemic. Authors who are parents, caregivers, researchers, clinicians, and affected individuals have written numerous other informational, touching, and inspiring books about this topic. This book's purpose is not a war cry for prohibition or policies to promote drastic reductions in alcohol consumption. It is a hearing aid to overcome deafness to public health warnings about the leading known preventable cause of birth defects and neurodevelopmental issues in the Western world: prenatal alcohol exposure. We all need to recognize that prevention includes promoting awareness about preconception health, contraceptive use, that is, pregnancy prevention for alcohol consumers, as well as avoiding alcohol if pregnant or planning a pregnancy. Tiring of the painstaking work reviewing difficult case histories of individuals who fell to death row through the gaping holes in our broken mental health system, I have redirected my efforts back upstream to public health. To that end, in 2014, I founded a nonprofit, Seventh Generation Foundation, INC, and started a prevention blog with a 25-year-old psychology graduate student from Germany, Daniela Milke. Seventh Generation Foundation aims to promote awareness about ND-PAE, prevent the condition through preconception health and safe sex for alcohol consumers, and develop safe, affordable housing and vocational supports for affected individuals. The proceeds from this book will, in part, provide the financial means to accomplish these efforts. At the time of writing this book, I am hopeful that our society is on the verge of recognizing the silent epidemic happening to children, adolescents, and young adults with ND-PAE. In the last 2 months, Kathleen Mitchell of the National Organization on Fetal Alcohol Syndrome has been on several national television shows after being interviewed for an article in the Washington Post about her 43-year-old biological daughter who has fetal alcohol syndrome. Last month, the Centers for Disease Control and Prevention issued a statement that alcohol consumers should use reliable contraception to prevent alcohol-related embryopathy, birth defects, and neurodevelopmental problems associated with exposure to alcohol prior to pregnancy recognition. This year, for Fetal Alcohol Spectrum Disorder Awareness Day, I am planning to have a Millions Who Recognize FASD March on Washington, similar to the Million Man March and the Million Moms March. Hopefully, sharing aspects of my personal and professional journey will create lasting societal change to protect our most valuable human potential, our children, and the young unborn yet to be, for generations to come. And since the writing of this introduction, of course, 4 years have passed. I wrote it, I think the introduction in 2015, actually 2016. So 3 years have passed. I unfortunately did not have a Millions Who March on Washington for FASD. That year we did a FASD Awareness Day event where we gathered together people who have dogs, and we promoted awareness here at the farm and did a small dog walk. But it is something that I still think needs to happen, is all the families and caregivers and advocates who are interested to promote more awareness and more policy changes on this issue really need to march on Washington, because in order to get more people involved, I think we have to have our voices heard on that level. The other issue is really getting the word out about the book, because in fact I am hoping to use the book as a way to spearhead efforts to get programs available for children through Seventh Generation Foundation. And to date, we are not where we'd like to be, but we are moving in the right direction in that way. We do have Dreamcatcher Meadows that I purchased 3 years ago here in Potomac, Maryland, and we're developing that into a wellness farm with inclusive programs for social, recreational, and vocational outlets for young people to be able to work together hand in hand, typically developing with those with neurodevelopmental differences. And hopefully one day we will be able to have programs available for not just children but also transitional age youth to come and learn hands-on skills. Right now what we offer is Saturdays on the farm every other Saturday during the warm seasons, and we're launching a program starting in a few weeks in May for young children ages 3 to 7 called, it's still going to be Saturdays on the farm, but kindergartening. And that can also be looked at as kinder gardening. So it's getting children together, typically developing with developmentally different children, and being able to have them do hands-on activities like caring for our animals. We have 12 goats, we have several chickens, we have a pig, learning to groom the animals, learning to take care of them, feeding them, watering them, and also being able to learn different types of activities like composting and growing their own fruits and vegetables, learning how farming works at those early ages, and getting the parents together with the understanding that they will help support their children staying in these blended groups, typically developing with those who have neurodevelopmental differences, because it's really going to take our society embracing the fact that there are approximately 1 in 20 individuals who have this condition. It far exceeds the combined rates of Down syndrome, cerebral palsy, spina bifida, and autism combined. So these children are already in our communities, these young adults are in our communities, these adults are in our communities, and many times they struggle socially to fit in, to feel like they belong, to feel like they have a livelihood, to feel like they can really be contributing members of our society. And we're going to need to start when these children are young to have them integrate just like they do in the school system. But unfortunately, very often, by the time they get to be in middle school, many of them are shunned, they're bullied, they're mistreated because of their differences. And we really need to begin within our homes and within our communities, helping children at early ages get along and to understand that no matter what their difference, we can all be a part of the same meaningful, purposeful activities. We can all include each other, not exclude children from play groups or activities just because they have a difference. So that's really become one of my main missions, is to develop this wellness farm so that anyone can come regardless of their ability and be able to interact with our animals and participate in the activities that we have here for social, recreational, and vocational development. I will continue to be reading different chapters of the book, and at the end of each chapter I'll give you a little bit of an update, and then hopefully none of the chapters will be too long. You can pause at any point, you can go back, you can ask questions through a little comments area, and hopefully I will be able to answer those questions as the channel continues. Thank you.